My name's Sydney Smith.
My name's Allie Stockton.
My name's Haley Shannon.
And this is our case study of the endocrine system.
Sarah walked into Dr. Zweigart's office and sat down with a sigh. Her hands trembled as she glanced again at the graded exam in her hand. I read and review my class notes and reread the assigned sections in the book, but for some reason I can't concentrate on much of anything for very long, and even when I can, I don't remember what I've studied by the next day. It's so frustrating to spend so much time studying and not retain anything. If I fail this class, my GPA might drop enough that I'll lose my scholarships. I'm so stressed that I can't sleep even when I try. Dr. Zweigart suggested talking all this over with a trusted family member or friend. She noted Sarah was strikingly quite thin, almost to the point of being too thin, and was extremely pale. Dr. Zweigart paused and chose her words with care. I also know there are terrific folks over at the health center who are experts in how to deal with stress. Sarah responded, "Thanks. I'll think about it. See you in class on Monday." However, Sarah didn't come to class on Monday or Wednesday. She emailed Dr. Zweigart that she most likely had a sinus infection and would miss class on Friday to see a doctor. Dr. Zweigart shook her head at Sarah's misfortune. Missing a week of class was not going to make it any easier for Sarah to pull her grade together for this course. Sarah made an appointment with the health center and sat in a small exam room. She felt extremely feverish and had a migraine. A sinus infection right before midterms was not what she needed. Dr. Klenda went over her chart and then gently palpated her neck. Your blood pressure and pulse are elevated. Your fever might account for that, but there could be something else going on here. Dr. Klenda began to fire questions at her. Did she have trouble sleeping? Did she often feel nervous or jittery? Had she lost weight recently? Sarah's head spun. Yeah, but I'm just stressed. With classes, aren't all those things just signs of stress? Dr. Klenda responded. They certainly can result from stress, and I see a lot of students where that is the case. However, there is a slight swelling in the front of your neck. That, combined with your other symptoms, suggests that perhaps your thyroid gland and pituitary gland isn't functioning quite the way it should, resulting in problems within your follicles stimulating and luteinizing hormones. Maybe your hypothalamus is releasing irregularities in your growth hormones. I'd like to take a look before we assume your symptoms are all due to stress. Let's start with some simple blood tests and see what we find. A week later, Sarah came back for the results. Well, your blood work does show some problems with your thyroid. Your TSH levels are lower than they should be. Your T4 levels are a bit high, and your T3 levels are very high. Those results suggest that you might have Graves' disease, which means that your thyroid is releasing too much thyroid hormones. Since thyroid hormones are responsible for your metabolic rate, that explains why your heart rate and blood pressure are elevated, why you felt nervous and can't sleep, and why you've lost weight even though you aren't dieting. Also, your pineal glands can also be the reasons for your sleep apnea. Dr. Klenda continued, I'm going to refer you to a local endocrinologist, someone who specializes in disorders like this. She'll probably order a radioactive iodine uptake test and a thyroid scan to confirm that you do have Graves' disease and determine the best way to treat it. Dr. Klenda explained that they cannot cure, but they can help the condition. Surgery to remove the thyroid is also an option, although not a common one anymore. The endocrinologist will evaluate her test results and help her choose the best treatment. Until then, Dr. Klenda prescribed a beta blocker that helped lower her heart rate and reduce that nervous feeling she had.